Why do I feel pain in my breasts? So you'll agree with me, the first thing that comes to mind when you feel pain in your breast is cancer, right? Good news is pain isn't usually associated with breast cancer. So what then is the reason for this pain you feel? My name is Stephanie Young, the health teacher, and in this video I'll be telling you why you may be feeling that pain in your breasts. So basically, breast pain is categorized into two major types: those associated with your menstrual cycle called cyclical breast pain, and those that aren't, which are called non-cyclical breast pain. So cyclical breast pain will usually start at 1 to 2 weeks before your period and gets better as time passes after your period. This usually happens as a result of fluctuations with the hormones estrogen and progesterone. So when people reach out to me via social media or when they come into the clinic and complain of breast pain, the first question I'll ask is, when and how often do you feel this pain? If it comes regularly at a particular time in your menstrual cycle, then it just may be cyclical breast pain. So first, you may want to determine your menstrual cycle length. That is, if you do not already know, is the time from the beginning of one period to the next time when your period begins. So it's usually between 21 to 35 days. And then once you've determined that, you'll want to keep a chart to pinpoint exactly when you feel this pain. So you can take down notes and record signs in your cycle tracking apps or your pen and paper chart. And of course, that's if you're like me, who is obsessed with pen and paper chatting, obviously. Now you do this for at least 2 cycles, and then you can now see and clearly confirm if it follows a regular pattern. So does it come 2, 3, 5, or 7 days before your period and improves afterwards? So once you establish a pattern, you can then be sure it is cyclical breast pain. And to further confirm if it is cyclical breast pain, you may also want to note if any of the following happens alongside. So do your breasts appear fuller or swollen, sore, heavy, lumpy, or tender? Do the lumps go away after a while after your period? Does the pain affect both breasts equally? So with this little information, tell me, do you ever experience cyclical breast pain, and what does it feel like? Were you always scared before you found out it was completely normal? Tell me in the comment section. If a woman's breast pain isn't associated with her menstrual cycle, then it is non-cyclical, some of which would require you get it checked, especially if this pain is constant and doesn't go away, or it comes and goes after several weeks. I'd like you to know that you can also feel breast pain when you wear a poorly fitted bra, especially if you have large breasts. A bra too small or too tight can cause pressure to the breast. You may feel the pain even extending to your neck and back. In this case, you need to first get a proper bra fitting and then a good supportive bra. Bra is very important. So some ladies also have what is called fibrocystic breasts. Now these breasts have tissues that feel lumpy or rope-like, in texture. Engaging in strenuous activities like cleaning, shoveling, activities that engage the pectoral muscles, that the muscles beneath your breast, can end up causing this kind of pain. Hormonal medications like birth control pills, hormonal transitions like puberty, pregnancy, or menopause. Injury, surgery, or trauma to the breast can cause this pain too. Mastitis, an infection often experienced during breastfeeding, can cause breast pain as well. Now for infections and other signs, like if the pain is accompanied with signs like skin changes, discoloration, difference in breast size, lumps, enlarged lymph nodes in your armpit area, nipple inversion, you'll need to visit the clinic as early as possible. It could be a sign of something serious. You'll be needing to visit the clinic for further investigations, which will usually start with a clinical breast examination, then an ultrasound or mammogram, depending on your symptoms and age. The earlier you get it figured out, the better. You can also visit our Center for Proper Clinical Breast Examinations. We'll do it for you and then teach you how to do it on your own. We also give you breast examination reminder cards to go home with. It will show you how and remind you too. So below this video, there are several links to more helpful resources you can use. Check them out. Do you still have any questions? Drop them in the comments below or send me a message or email using the links below this video. Cheers to being a healthy woman.